my name is Kelly, and I've been a patient of Dr. Lynn's for a couple of years now.
What was life like before we did the PRP treatment for your back? Like, what were you unable to do that would slow you down, get you upset?
Well, leading up to this, I was a gymnast, a college gymnast. I was on the U.S. gymnastics team, so I had some, deterioration, leading up to the accident that I had in 2015 when I was having a golf lesson and I was driving the driver into the ground, and that's what started kind of my downfall with my back. And it just gradually, year after year, got so I could do less and less. It started with hiking. I couldn't hike on uneven surfaces anymore. There were just certain things that I couldn't do anymore.
Okay.
And I was like, as long as I can walk as far as I want to, I'll be able to travel. And I'll just keep doing what I'm doing. But gradually that was taken away from me.
Being able to hike, travel, walk.
Yes. In Christmas of 2023, I actually got to the point where I was being wheelchaired through the hospital or through the airport because
Wow.
I had gotten so bad.
And you've been active your whole life otherwise.
I have, yeah.
So what finally triggered you to say, I gotta track Dr. Lynn down here in Honolulu? What?
Well, we moved over here, and where we were living before on the mainland, there just weren't options like that. We would have had to have driven down to Seattle and it just seemed like a lot of coordination that was going to be difficult to do where in the location that we were living in.
Okay.
And then moving here, I saw it as more of a possibility because you were close by and, with my family's support to help take care of me through the process. And, I got to a point where I wasn't living how I wanted to. I was 51 years old and there was so much more that I wanted to do. And it was very, very limited as to what physical activity I could do at that point.
And moving to Hawaii also, this is the best place in the world to be outside doing stuff.
For sure. Yeah. So I kind of, I could walk less and less. And so then water activities became much more important. I could do various forms of paddle boarding. I could kayak okay. I could swim, but that was even a little bit tricky with my hips and my lower back. But yeah, the water became much more important to me.
So what kind of concerns were you worried about? Now, we talked a bit ago, mm-hmm. and you were struggling with back pain. Mm-hmm. But what kind of concerns did you have about the procedure itself, kind of going into it?
I guess like the biggest concern that I had was, having babies, you have epidurals and things like that. So I was like, okay, this is probably going to be sort of similar to that. And for me, that was the most challenging part of having a C-section and all of that. I was like, good, I never have to do that again. But then I was like, oh my goodness, this is very, very similar, Mm-hmm. But, you get to a point and you're just like, I got to give this a try. I have so many more years of my life to live, and, I trust you, and I knew you would take good care of me and your staff here, and I was like, we got to go for it.
and how was the procedure itself? How did you feel about how it went that day?
I felt in such good hands with you and the rest of the staff. I mean, you talked through it with me every step of the way, and I never felt out of it or anything. I felt like you were really helping to guide me in those two different procedures that we did. Mm-hmm.
All right. Well, that's great,
yeah.
Kelly. I'm so happy to hear that you had such a good experience. And what kind of downtime did you have afterwards?
I would say I was pretty sore for 2 to 4 days afterwards. Mm-hmm. But, I was getting up and walking around. It was more so like just trying to sleep and like the rolling over in bed that it was kind of sore with that. But I was kind of doing normal things within a week and driving and walking, what I could do. But that's, within a week we started the physical mm-hmm. therapy, and that was, one of the big keys to all of this too. Mm-hmm.
So you're able to start physical therapy within a week?
Yeah, it was within a week.
And so you mentioned that this past December you were really, really unhappy. You said you even have to take a wheelchair getting to the airport.
I did.
And so what's life like now? What's it we were talking earlier, but can you tell the folks like what kind of things you're able to do now that you couldn't do even 6 months ago?
Well, I definitely attribute it to, so we did the injections in January and February, and then between January and May, we did physical therapy the entire time. And I was very dedicated to learning the exercises, to memorizing them, doing them morning and evening, very, very diligent about it, because she was helping to guide all of those things that needed to be strengthened and balanced out. And you got to put that effort into it, to get the results on the back end of it. So I was aiming we wanted to go on a family vacation this summer, and I was like, I gotta do everything I can to be able to do this successfully. And so we were just able to go to Japan a couple of weeks ago, and we walked 65 plus miles all together over the 9 days. So that just, it blew my mind when my son told me that we had walked that far.
Oh, he's keeping track of everything.
He was, yeah.
You're just enjoying the trip. He's keeping track.
Yeah.
Oh, that's awesome. That's awesome. So what would you tell someone who's thinking about our clinic here? Any words of advice or wisdom there for them?
I would say definitely for them to come in and speak with you, and you guys can talk through the situation. I loved how you just, very quickly, you're like, we got to get in for x-rays, we got to get in for MRIs and really see what's going on here. You just took charge, and that game plan that we had, everyone just kind of needs to know what possibilities they have for the future, and if this is the right fit for them, and I'd say go for it.
Well, gosh, Kelly, thank you so much for your kind words and sharing your experience with everyone today.
Oh, thank you so much.